First of all, I will introduce to our group member. First, we have Muhammad Afiq Farhan bin Muhammad Jasmine, student ID 2022839514. The second member, Syahmiani bin Saliadi with student ID 2022834412. After that, we have Zulhami bin Azli Rombles, student ID 2022491928. Next, we have Ahmad Zaki bin Ashran, student ID 2022894934. The second last, Muhammad Kamal Zuhairi bin Muhammad Suhaimi with student ID 2022476748. Lastly, we have Nur Azizi bin Azhar with student ID 2022475932.
So before we move to another slide, let's know what is the COVID-19. The COVID-19 pandemic is a global disease 2019 pandemic caused by the coronavirus 2 or SARS-CoV-2 that leads severe acute respiratory system is a part of the coronavirus family, which is include a common virus that caused but a variety of disease from head to chest cold to more severe acute respiratory syndrome SARS and Middle East respiratory syndrome or MERS. So for this statement, we can conclude the COVID-19 caused by the SARS-CoV-2 coronavirus is a global health crisis leading to severe respiratory illness. It belongs to the coronavirus family, known from the causing a range of disease from the common colds to more serious conditions like SARS and MERS. So from these two pictures, we can see how our frontliners is on duty during the COVID-19 pandemic, and don't forget every sacrifice they make to ensure we all safe when MCO is carried out. So from these two pictures is tell about how the sacrifice of the frontliners to protect our community from the COVID-19.
Now, I will explain about the chronology of COVID-19 in Malaysia. On 16 January 2020, Malaysia reported its first confirmed case of COVID-19 involving 3 Chinese nationals. Next, on 31st January 2020, the World Health Organization (WHO) declared the coronavirus a global health emergency. After that, on 18 March 2020, the Prime Minister Tan Sri Muhyiddin Yassin announced the movement control order for 40 days from March 18 to March 31. After that, Malaysia begins its COVID-19 vaccination campaign, focusing on the frontliner, which is police, firefighter, soldier and doctor. This vaccination campaign begins on January 2021. After that, at the end year of the October 2021, vaccination effort become more to improve the immunity of the citizen. By taking the booster vaccination, it improves our immunity to the high level. Lastly, on January 2022, ongoing management of the COVID-19 situation, including vaccination campaign, public health measures, and adapting to the evolving global situation. The first case of COVID-19, a cluster of pneumonia of unknown origin, was identified in Wuhan, China on December 2019. The total cases of COVID-19 that has been recorded is 696,974,550 people that are affected with this virus, and 691,668 people died because of this pandemic.
Let's take a closer look at the pandemic journey in Malaysia as depicted by the graph. In 2020, it all began with 108,000 cases catching the public off guard. The situation took an alarming turn in 2021 with cases skyrocketing to almost 2.5 million, leaving the nation in disbelief. However, in 2022, there was a glimmer of hope. Strict measures, including the Movement Control Order (MCO), led to a slight decrease. bringing the cases down to 2.2 million. Then, in a surprising turn of events in 2023, cases plummeted to 107,000 cases. The government announced an endemic phase as follows. This drastic improvement is credited to vaccination efforts surpassing 90% of the first dose, a milestone that signals the beginning of a new chapter in Malaysia's fight against pandemic.
In the evolving landscape of the COVID-19 pandemic, new variants have emerged, each with its own set of challenges. Let's take a closer look at some key variants that have made an impact on the global stage. First, Alpha, first identified in the United Kingdom in September 2020. Then Beta, originating in South Africa in May 2020. Then November 2020 witnessed the first appearance of the Gamma variant in Brazil. In October 2020, the Delta variants emerged in India. Fast forward to November 2021, the world faced the Omicron variants, with cases reported in multiple countries. By staying informed and united in our effort, we can adapt to the challenges posed by these variants and work toward a safer, healthier world.
Next, we are going to see the type of symptoms for COVID-19. So the most common symptoms are fever, cough, loss of taste, and tiredness. Next, we have the less common symptom. So people with less common symptom are rarely to have the COVID-19, but it is always important to make sure that we have it or not. So if you have sore throat, headache, aches and pains, you should check if you have a COVID-19 or not. And last but not least, we have the serious common symptom. Example like chest pain, difficult to breathe, and loss of speech. So people with serious common symptoms are most likely to have COVID-19. So if you have any of the symptoms that we stated right here, you should check if you have COVID-19 or not, just to be safe. Next, we are going for the transmission of COVID-19. So this is how COVID-19 spread. So you all must be aware and avoid this transmission of COVID-19. So first of all, COVID-19 travel to cough and sneeze from people who have the COVID-19. Next, physical contact from the people who have the COVID-19 also spread the COVID-19 to other people. And last but not least, touching the surface of an object that has been infected with the virus also can give you the COVID-19.
In a world facing unprecedented challenge, it's crucial that we protect ourselves and others from the threat of COVID-19. Here are 4 simple yet powerful ways to prevent the spread of the virus. First and foremost, wear a mask. Make sure your mask covers your nose, mouth and chin. It's your shields against the invisible enemy. A mask not only protect yourself but also those around you. Secondly, get vaccinated. Vaccination is our strongest weapon in the fight against COVID-19. If you never received COVID vaccine yet, I provide you with the link on how to book COVID-19 vaccination appointment in Malaysia. Thirdly, keep a physical distance. Keep physical distance of at least 1 meter from others, even if they don't appear to be sick. Whether you are at work, in a grocery store, or socializing with friends, maintaining a safe distance helps prevent the spread of the virus. Lastly, practice good hygiene. Wash your hands regularly, use hand sanitizer, and avoid touching your face. This simple action can significantly reduce the risk of infection. Let's stay committed to this practice, not just of our own well-being, but for the health and safety of our communities. Together, we can overcome this challenge.
We know that the old people can easily get affected by any disease because their antibody become weak due to the age. But the most reasonable is difference in between two gender. Men have a high percentage than women to get affected by a COVID-19. During a COVID-19 pandemic, a School of Medical published a report about a COVID-19 who were admitted to Jiyintan Wuhan Hospital. Between 1 January and 20 January, the report said that the number of male patients outnumbered women patients more than 2 to 1 patient. The data is taken from 21 hospitals in Wuhan between 21 January until 20 January, revealed that 75% of those who died were men.
So this graph presented in the pie chart table, and this pie chart show that the COVID-19 affecting more male compared to female, which is male is 55% and female only 45%. This kind of thing happen because of a few factors that we will talk after this. So let's go, we move to another slide.
The first risk factor is genetic. Women generally have a stronger immune system due to genetic factors with the X chromosome housing many immune-regulating genes. This leads to enhanced immune responses seen in past epidemics like MERS, SARS, and the 1980 Spanish influenza, where men more severely affected. Women also show better post-vaccination antibody responses, improving immune memory. However, this heightened immune activity may make women more susceptible to autoimmune disease influenced by sex hormones like estrogen. Other factors such as mitochondrial DNA inheritance, the gut microbiome, genomic imprinting, and chromosomal inactivation contribute to sex-related differences. The double XX chromosome configuration in women provides more immune-regulating genes, resulting in a more robust immune response, especially against viral infections. Hormones like estrogen impact infections through metabolites binding to receptor. It's important to take note that immune response differ between the sex, and age-related decline in specific immune cell affect men and women differently. For instance, aged women may have lower natural killer and memory tract cells, leading to altered immune response and reduced cytokine production in older men. Next, the risk factors is lifestyle. Smokers face elevated susceptibility to respiratory disease, contributing to smoking being the third leading global cause of death. In the context of COVID-19, smokers are at a heightened risk due to hand-to-mouth transmission and increased age-to-exposure. Men generally smoke more than women, and study indicates smokers face greater severity, ICU admission, and death from COVID-19. Urgent smoking cessation is vital to mitigate the global impact of the pandemic. Furthermore, men tend to drink more than women, and women generally have lower rates of alcohol-related problems. Alcohol-related liver disease is a significant cause of liver cirrhosis, leading to high mortality and morbidity. A recent study found that COVID-19 patients with underlying chronic liver disease experience greater severity and mortality, emphasizing the impact of these conditions on the outcome of COVID-19.
So this is a graph for asset astonishing gender gap in tobacco use. We can see that green represent for male and orange represent for female. The country like Indonesia, Chinese, Russia, France, and other countries, we can see that whatever country, male become the dominant user of tobacco. Okay. As for this one, this is the statistic of the gender gap in alcohol attributable death. We can see that red represent for female and blue represent for male. We can, from the statistic, we can conclude that male still become the dominant user of alcohol, same as the tobacco.
Last but not least, the risk factor is behavior. Emphasizing the importance of preventive measures such as hand hygiene is crucial for combating infections like COVID-19. Hand washing is a cost-effective method to prevent both respiratory and gastrointestinal infections. During the pandemic, it became a key recommendation worldwide. Research indicates a notable gender difference in hand washing frequency. Women tend to be more diligent in personal hygiene, washing their hands more frequently and thoroughly. Studies by the American Society for Microbiology and the Soap and Detergent Association consistently show that men are less likely than women to wash their hands after activities like eating, using the toilet, feeding animals, or sneezing. Given the effective hand washing is a primary method for COVID-19 prevention, This gender difference may contribute to a higher infection risk for men.
In the battle against COVID-19, researchers have uncovered intriguing differences on how virus affects the men and women. From the presentation, we explored the key findings from a recent study shedding light on these gender disparities. The study concludes that men may experience more severe outcomes due to a combination of factors, including genetics, lifestyle choices, and differences in immune responses. Genetics and less efficient immune responses appear to contribute to the heightened vulnerability in men. However, it does not stop there. Lifestyle choices such as smoking and alcohol consumption play a significant role. The study highlights how these choices, coupled with variations in health awareness and risk exposure, disproportionately impact men. Understanding these factors isn't just about the present, it's about arming ourselves with knowledge to develop strategies that can bring an end to the current pandemic and prevent potential future ones. These insights could be the key to fortify our defenses against future health challenges.